all across New York State, the number of confirmed COVID-19 cases continues to rise. Nassau County has more than 7,000 people who have tested positive. So how are they doing? Well, we are checking in via Skype with Nassau County Executive Curran, who joins us now. Good to see you.
Hi, good morning.
All right, so let me ask you, we're going to get some new numbers today, but I want to get the state of the healthcare situation that folks are dealing with there. With the arrival of the Navy hospital ship, beds going up at the Javits Center in Central Park, New York City is really bracing for an influx of COVID-19 patients. But what sorts of preparations are being made in Nassau County?
Well, I'm speaking to all of our hospital executives regularly, and they're concerned about three things. They're concerned about staff, making sure that their staff, which is really stretched now, is able to handle the upside of the curve that we're entering right now. They also want to make sure that their staff has the personal protection equipment, the PPEs that they need to keep themselves healthy, to keep themselves safe. And of course, the other concern is ventilators. Are there enough ventilators for the people who need them? And we're tracking that every single day.
Well, what are you hearing?
The county has ordered.
What is staff telling you?
We're hearing they're really up against it. I mean, the concern is real. We have a donation center that we've organized at the county, the hospital executives, the state, everyone is scouring the globe for this really important equipment, the supplies. And then, of course, we have to make sure that we have the staff that's able to do this. So I know the state is working on a new medical facility at SUNY Old Westbury at our university. The concern is, will there be enough staff to actually man it?
Have you put out the call? We know the governor has put out the call to folks to please come and help us. What about you? What are you doing in your area to maybe get some of these retired nurses and medical professionals out of retirement and back on the front lines?
Yeah, we're working closely with the state on this. I want to commend the governor for the amazing work that he's doing and his leadership in this. And I think the thing that we all have to remember is that this is a crisis. We have to brace ourselves. We're really going to have a very, very difficult week. We have to be very cognizant of that and face it in a very clear-eyed way and try and get everything in. Everyone really has to do their part here, whether it's staying home. I know people are hunkering down and doing the homeschooling and working from home, which is very difficult. But always keep in mind that this is temporary and life will find its balance again. It always does after a crisis. We just have to get through this as intelligently and strategically as we possibly can.
Absolutely. There will be light at the end of this very difficult and dark tunnel right now. How is testing coming along in your county? We know in other places it's really difficult for folks to even get a test. So what's the situation there?
Well, there was a lot of testing at Jones Beach. There is still testing down at Jones Beach that the state is doing, but the focus is now more shifting to doctors' offices, to urgent care, to medical centers for testing. But the criteria for testing is still not changed. It's for people who are symptomatic and for people who have come into close contact with a confirmed positive case. And if there are any questions, the state hotline is always up and running if you have questions about testing.
A lot of people don't see the real dangers of not being social distant from others. We saw this yesterday. You were holding a press conference and then someone drove by shouting, "Open things back up," right? If you had a chance to talk to that person one-on-one, what would you say?
I would say, look, I really get that you're frustrated. I mean, we're all frustrated. I'm homeschooling my kids. I'm an expert now on ancient Athens. Never thought that would happen. It is difficult. It is not easy. This is a new normal, but we all have to do our part. And I want to remind that guy, this is temporary. If we all do our part, continue the social distancing, working from home, we will get through this.
A lot of folks are just really focusing, like you said, trying to get through the emergency situation right now. But on the back end, that's where it's going to be scary as well, right? Because you have the economic fallout of all of this. So how are you preparing for that?
Well, I've convened an economic advisory council. And we're doing a survey. It's actually due tomorrow. So if you're a business owner in Nassau County, please go to hofstra.edu/economic impact. We're gathering all of this data so that when we go to the federal government for help, we'll have real tangible data to show what the need is. People are being laid off. People are losing their jobs. They're losing their paychecks. There's a huge personal and economic impact to this crisis. We want to make sure that we're quantifying it so that we can be better prepared when this is over and it's time to rebuild. Because you're absolutely right. The crisis is tough. The rebuilding is going to be a challenge as well. So we want to make sure that we're not postponing, procrastinating, getting all of that information together. And we've had a wonderful response from our business leaders. And I just want them to keep it coming.
Last question for you. I know that you're trying to crack down on people with scams, really trying to take advantage of folks who are worried about COVID-19. So what are you doing along on those lines?
If there are episodes of price gouging, people can go to price gouging at nassaucountiny.ny.gov. It's really despicable that people in this real financial problem, health problem, social problem, real crisis, that people are taking advantage. We have spoof calls, people pretending to be our health department, asking for very personal information like security card number, social security numbers. You never give that out. The old rules still apply, even in a crisis. Don't give out credit card information, social security information, Medicare information.
All right, County Executive, thank you so much for your time today. We appreciate all that you're doing. Stay safe, stay healthy. We hope to talk to you again soon.
Thank you very much. Stay safe.